That is Sweet with Little Willie. Hey, everybody, it's Tad Jessup, and last night I went on my latest ride in my training for pedaling for Parkinson's, which is happening July 11th to the 13th this summer for Parkinson's research. Went 16 kilometers on my bike with Peter Istvan. Needless to say, I'm feeling it today, but I'm feeling pretty good, getting in preparation to do 100 kilometers on the big day for me, which will be July the 13th. Now, when you donate, it's always a good idea to know where your money's going when you're donating to the Parkinson's research. And with me on the line right now is Dr. Ali Salahpour, who was the 2013 Pedaling for Parkinson's Research Grant recipient. Dr. Salahpour, thank you so much for joining me today.
My pleasure, Ted.
So I want to get into some of the research that you've been doing over the past year with the grant, particularly in the means of dopamine and how dopamine's connected to Parkinson's. Could you explain that for me?
Sure. So in Parkinson's disease, what happens is that the cells that produce dopamine in the brain are degenerating, so the patients end up having less and less dopamine available in their brains. Currently, the therapy that is being used is called the dopamine replacement therapy, which is L-Dopa, is the compound that the patients take. And essentially, L-Dopa goes in the brain and it's converted to dopamine, and it replaces the dopamine that is lost. And this is a great therapy, and it really works well for a limited number of time, around a year or two for the patients. What happens is that over the years, the patients develop a complication called L-Dopa-induced dyskinesia, which means that as they take L-Dopa, there's some complications, side effects that arise from taking that drug. So the research that we are doing is based on a protein called TAR1. It's a protein that is in the brain. Mm-hmm. And we have shown that if you block TAR1, you can increase the actions of dopamine and the actions of L-Dopa, presumably. So what we're trying to do, and we have done so far, is we've tried to find some blockers, some inhibitors of TAR1. And essentially what this would do, it would enhance the actions of whatever dopamine the patients already have, or the actions of L-Dopa that the patients are taking. So what this does is that a patient that is already taking L-Dopa, instead of taking, let's say, 100 milligrams, they might only need to take 50. Okay. And if they take a lower dose, they would have less of these complications. So that's essentially what we're trying to do.
Wow, and I understand that the possibilities of the future of treating Parkinson's, well, they're going to benefit huge by this research.
I think so. It is clear that the patients that have the disease, their quality of life is extremely affected by this loss of motor function, which is the main symptom that the patients have. They have rigidity, they can't move properly. L-Dopa can alleviate some of that at the early stages, but in the late stages, this L-Dopa-induced dyskinesia can become quite a big, important hindering to their quality of life. So if we can find drugs that would improve the actions of L-Dopa, and therefore reducing the dose, it would essentially improve the quality of life of the patients. Yeah, that would be a nice thing. Yes,
it'll be a game changer. That's phenomenal, Doctor. Keep up the good work that you're doing. And for people who are participating in pedaling for Parkinson's, hearing this kind of news is really encouraging. Then know that their donations are going and possibly to one day find a cure for Parkinson's disease. It's incredibly encouraging. And Dr. Salahpour, we really appreciate the work you've been doing.
My pleasure, Ted. And just a plug, I will be riding with you guys as well. So,
you will?
I'll be in Perry Sound for one of those riding days.
Oh, sure. Fantastic.
This is my way to thank the Pedaling for Parkinson's folks, and it is tremendous to contribute to this important cause. I just wanted to say that.
Well, Dr. Salahpour, I hope to see you out there. I'll be the chubby guy who will have to start and stop quite a few times. That'll be me.
That's great. I'll be riding next to you.
Beautiful. Well, thanks so much, Dr. Salahpour. Really appreciate it.
My pleasure. Take care.